Welcome back to part 2 of the lecture. I was just in the middle of talking about this fun word, gamma aminobutyric acid, or GABA, so I'm going to start there. It is a neurotransmitter that inhibits abnormal neural activity. Some of the newer anti-seizure medications target this neurotransmitter, and some of the new medications also increase the production of GABA, and others, such as the benzodiazepines, and these intensify the effect of the gamma aminobutyric acid transmitters in the brain. I think we should try to do a tongue twister here. How many times can you say gamma aminobutyric acid? There's so many words, sometimes we stumble over them. Okay, I hope that I picked up at the right place from the previous lecture. We're going to go ahead and move on. Continuing to talk about medications to treat anxiety, insomnia, sedation, and seizures. Barbiturates induce sleep. They do this by depressing the central nervous system. And non-narcotic benzodiazepines, hypnotics are things like Ambien or Lunesta, and these promote sleep with few side effects. We do see sometimes sleepwalking and some other things within that. There is a possible addiction risk to benzos, so it's important that in patient teachings that is made clear with the patients, and also keeping track with the patients as they're continuing their visits and checking in with them on how they're feeling. So barbiturates and anti-seizure medications, they delay sodium from crossing neural membranes, and this calms the cells. The drug of choice is for tonic-clonic or grand mal or partial seizures are the barbiturates and anti-seizure medications. Barbiturates such as luminol are used for tonic-clonic and febrile seizures. Ethosuxamides such as Zerontin delay calcium moving over the neurons to relax nerve cells. This is the drug of choice for petit mal seizures. The gamma aminobutyric acid, GABA, it is a natural occurring neurotransmitter inhibitor. If present, it will decrease seizure activity. An example of this is the new drug vigabatrin or Sabril, and benzodiazepines such as Valium or diazepam. They intensify the effect of the gamma aminobutyric acid transmitters in the brain. Central nervous system stimulants are used to treat attention deficit disorder, ADD, and attention deficit with hyperactivity disorder, which is ADHD, which stem from an ineffectiveness in impulse control. Both ADD and ADHD stem from an ineffectiveness in impulse control. So administering a central nervous system stimulant increases the patient's ability to focus on a few stimuli instead of focusing on all the stimuli. For example, somebody with ADD might hear all of the sounds in the room, including, the fan going, the wind blowing, somebody tapping their pencil in the back of the room. And this medication helps them to deplete some of those other stimuli and move it down and able to focus on a few. This in turn calms them. Amphetamines, which are a type of central nervous system stimulants, may be used also to treat obesity. So depression. Some signs and symptoms might be excess of sleeping and eating, inability to concentrate, avoidance of companionship, decreased interest in sex, feeling of despair. These are all things that we see in depression. And when neurotransmitters are depleted, the patient does not think clearly and the mood is depressed. So treatment for this as far as medications are usually antidepressants, and these preserve the neurotransmitters at the synapse. So looking at MAOIs inhibit enzymes that stop the action of neurotransmitters. Elderpril is an example of this. And with MAOIs, it requires dietary exclusions of food containing tyramine. Some examples of these foods might be aged cheese, beer on tap, red wine, sauerkraut, soy sauce. There are also tricyclic antidepressants. This is a 3-ring chemical structure that keeps the norepinephrine and the serotonin at the nerve terminals. This is the drug of choice if a patient has insomnia due to sedative side effects. Brand name Elavil or generic name amitriptyline is an example of this. And then we have the antidepressants, the selective serotonin reuptake inhibitors, the SSRIs. These prevent serotonin from being used up at the synapse. There are few side effects, thus usually the first choice. So Celexa, Prozac, Paxil, Zoloft. So typically with antidepressants, this is where they go first because of the lesser amount of side effects. Serotonin is a chemical that's produced in the brain and it acts as a neurotransmitter. Low levels have been implicated in depression. So if you have those lower levels, they see that in patients with depression. So serotonin norepinephrine reuptake inhibitors, SNRIs, these block reuptake of serotonin and the norepinephrine. The increase in levels of serotonin and norepinephrine is shown to elevate the mood. They have few side effects as well, and some of the examples would be the Effexor extended relief and Cymbalta. Mood stabilizers stabilize extreme mood shifts seen in patients with bipolar disorder. Most commonly, lithium is used. Bipolar disorder, also known as manic depression, is characterized by extreme mood shifts between mania and depression. Medications used to stabilize these extreme mood shifts are known as the mood stabilizers or anti-manic agents. The drug of choice is lithium, as I said before, and this is a salt base. Therefore, patients using this medication should avoid dehydration and avoid table salt. This medication also has a small therapeutic range and toxicity can be fatal. So patients must have their blood levels monitored frequently. Taking a look at antipsychotic medications or neuroleptics, chlorpromazine, clozapine, and thioridazine. These treat abnormal actions and behaviors or psychosis, such as talking and interacting with situations that only they can see or hear. It's also used for other symptoms, nausea, vomiting, spasms. So we need to know why a patient is on the drug. Psychosis is a class of disorders characterized by abnormal thoughts, disorganized communication, and lack of interaction with the environment. Frequent symptoms of psychosis are delusions, hallucinations, paranoia, and bizarre thoughts and behaviors. We are now on comprehension check number 4. So the question is abnormal thoughts, disorganized communication, and lack of interaction with the environment characterizes, and that would be B, psychosis. Looking now at dementia. So this is progressive, irreversible, and there is a decline in mental function. Alzheimer's disease is the most common cause. The goal of therapy here is to prevent or slow down further deterioration. There is no current cure. Aricept, this is a cholinesterase inhibitor, and it is showing promise in slowing down the progression. Looking now at Parkinson's disease, this is a degenerative disorder of the central nervous system. The neurons that produce dopamine die and muscle movements become disorganized. The lack of dopamine and increase in acetylcholine causes tremors, slow movement, rigid muscles, and balance problems. So anti-Parkinsonian drugs focus on keeping dopamine and acetylcholine at the nerve synapse. So the anti-Parkinsonian drugs, dopaminergic, is replacing or increasing dopamine. So Eldepril or Requip would be examples of this. Cholinergic agents, those that inhibit the action of the acetylcholine, such as aconine. Patients need a combination of drugs to achieve sufficient dopamine levels. So the combination of drugs, the blood-brain barrier makes sufficient dopamine difficult. Thus, the combination of drugs allow smaller doses to achieve this. And then it's important that there is a drug holiday when the dose cannot be increased or side effects are intolerable. The doctor orders a drug holiday at this time, and the patient stops the medication for a week or so and then restarts them at a lower dose with the desired effects. Let's look at anesthesia. Anesthesia means the loss of sensation and can be administered locally to create a lack of feeling without loss of consciousness. So local anesthesia can be applied to a surface or it can be injected, and anesthesia blocks the entry of sodium ions into nerve fibers to produce a numbing sensation. Local anesthetics are classified as esters and amides, and they come as creams, aerosol sprays, otic, or ophthalmic drops, or injectable solutions. Amides tend to last longer. So some amides might be lidocaine or novocaine, and some esters are procaine or tetracaine. So looking now at general anesthesia causes a patient to lose both feeling and consciousness and can be administered via IV infusion or inhalation. And this is typically done in a hospital or outpatient surgery center. It's not something that you will see in your ambulatory care facilities, but just to give you a little bit of background, general anesthesia is used for long procedures. The IV agents are given and they're followed by inhalation medications. The use of IV agents allows smaller doses of inhalation therapy medications, thus reducing the risk and severe side effects. Inhaled general anesthetics are volatile and can depress respiratory and cardiovascular function. So again, this is under the care of the physicians and anesthesiologists, and you won't see this in just a normal ambulatory care setting where you're working as the medical assistant. Let's look here now at alcohol and the CNS system and how that works. So alcohol is a central nervous system depressant, and it's rarely prescribed as a medication. It does, however, interact with other medications and can have powerful effects on the body. So added to medication, it can cause confusion, peripheral vasodilation, increased heart rate, electrolyte imbalances, and decreased motor coordination. Prolonged use can permanently damage the central nervous system and permanently damage the liver. It's important to recognize that irritability, tremors, GI disorders, frequent falls, blackouts, confusions, neural and muscular weaknesses can all be signs of chronic alcoholism. Treatments are antabuse, behavior modification, vitamin B injections, and dietary changes. I hope that you have a great day, and this concludes our lecture.